Good evening. In the programme, the rapidly deepening public alarm over the killer disease AIDS. A report by Robin Denslow explains the real risks for those who come into contact with AIDS victims and the real cost to the National Health Service. Today, a blood donor died in Bournemouth of the so far incurable disease AIDS, which can be transmitted through the blood. The man, in his 20s, is known to have given blood to 51 people, including a toddler, and they now stand a risk, albeit very small, of developing the disease themselves. The latest incident can only add to the near panic and hysteria that AIDS has caused in Britain since the start of the year. So far, there have been 118 AIDS cases in Britain, and today's death brings the number of AIDS deaths here to 55. The pattern in Britain is similar to that in America when the disease first emerged there and spread at an alarming rate. In 1979, America had just 10 cases. Last year, there were 4,000 new cases, bringing the total so far to 8,000. With numbers in Britain now doubling every 8 months, specialists warn that we could have 5,000 cases in 3 years' time. So the pressures are growing on our hospitals, on the blood transfusion services who might be handling infected blood, and of course on Britain's homosexuals who've been the main victims. So is the panic justified? Robin Denslow now reports.
This is a new and frightening disease, one has to accept that, and we spend a lot of time at the moment educating our staff in order to explain to them this is not a very infectious disease, that they are not running a risk by treating them and by helping.
AIDS has become a national obsession. Just the word sells newspapers, panics normally unpanicable prison officers, and threatens an anti-homosexual backlash. For these nurses, it's just another disease to be treated, but they need reassuring.
That must mean that you have certain worries. You certainly are looking after several patients. We have 2 in the ward at the moment and 1 other with HTLV3 disease. And I was just in physiotherapy and there's a patient down there.
5 of these London nurses already treat AIDS patients. As the disease spreads, with the number of those stricken doubling every 8 months, advice sessions will, it seems, be necessary in every general hospital in the country.
How do you counsel patients when you have a patient comes into your clinic?
Yes, I think one has to be very honest with patients, particularly with serious disease, and particularly with a sexually transmitted disease that a patient can pass on to others.
The nurses are advised how to treat patients with a disease for which there's still no cure. They're also told that the AIDS virus, which destroys some of the body's defences against disease, is just one form of a virus called HTLV3, and that only about 10% of those with HTLV3 develop the full AIDS syndrome. And despite all the public panic, AIDS specialists insist it's not that infectious, except through sex or through blood.
I think it should be emphasised to the public the risks are absolutely tiny. I mean, there are a large number of cases in the States. Not one nurse or doctor caring for these patients, not one cleaner, has developed AIDS as a result of contact with these people. Of all the prisoners in the United States who have AIDS, there's not a single prison officer who's developed AIDS. So I think the risks are absolutely minuscule. I think one of the recent problems has been that the virus has been described in saliva. Now that, of course, conjures up all sorts of worries about what saliva may do. I think it's fair to say that the virus is a relatively sensitive virus. It doesn't like being out in the cold light of day, and therefore it's likely it's destroyed very quickly as soon as it leaves the mouth. And I don't think there are any recorded cases of people kissing getting AIDS or anything like that. Of course, one has to be cautious because it's a new disease and one doesn't really know about all the possible infectious routes.
There is no evidence that the virus is spread in a casual setting, and there is absolutely no reason why we shouldn't accept people with HTLV3 infection in our society as with any other infection. There are many people around in society who have infectious disease, which is much more infectious than this virus. These people do not pose a risk to people with whom they are in casual contact, and it's very important that we all recognise that and come to live with and understand this disease. It is not very infectious.
So if there's an AIDS sufferer who's in the community and not in hospital, he's not dangerous?
Absolutely not.
It's been called the gay plague, the gay disease, because the majority of the sufferers are homosexual men at the moment. Could it cross over to the heterosexual community? Could it cross over to women?
Well, it already has. I think it's important that we recognise that gay men have borne the brunt of this disease for a variety of reasons, but it has always been evident from very early on that the disease can be transmitted through conventional heterosexual intercourse. And therefore we have seen instances, largely in the United States, where women who are heterosexual contacts of patients who are infected by this virus have developed AIDS.
But at the moment, the vast majority of AIDS sufferers are male homosexuals, and those at risk can come from any walk of life, including the media. Harry Cohen is a senior journalist who edits a section of the Sunday Times. Until last year, AIDS was something he just wrote about. Then, out of the blue, he received a warning that he could be at risk.
It was a quiet Tuesday lunchtime at work. Most of the other executives were out to lunch, but I had an early deadline. And in the sort of very quiet moment, suddenly there was a phone call. And I heard a female voice saying, "Is that Mr. Cohen?" "Yes." "Can you talk?" So I informed the woman that I could talk the hind leg of a donkey if need be. And she said, "No, it's not like that, it's something personal." So I sort of suddenly felt a bit serious, whereupon she informed me that it was St. Mary's Hospital. They had a patient who had been recently diagnosed as having AIDS, and this was the bolt from the blue, informed me that this person had given my name as a contact within the past 2 years. And at that, I have to say, there was a sudden chill, because I've suddenly thought, I had been saying for a couple of years that the AIDS net was going to close in on us, on all gay men, and eventually, indeed, on everybody. Because sooner or later, we would all know somebody who had either had got it or was at risk. And here, me, the prophet, was being informed my own prophecy had come true on me.
Following normal medical policy, Harry Cohen was not told the name of the AIDS patient who'd given his name as a contact. Cohen went to St. Mary's Paddington, one of 3 London hospitals that currently specialise in AIDS. Here he was tested for any possible signs of the disease. And, of course, his blood was tested. The test is not for AIDS as such, but rather for the HTLV3 virus. If that was present, Harry Cohen would know he had a 1 in 10 chance of contracting AIDS. But he wouldn't know the results for several weeks. For those who see AIDS as divine retribution against the homosexual community, Harry Cohen's lifestyle might come as something of a surprise. For a full 15 years now, he's maintained a relationship with the man with whom he shares a South London flat and a cat.
Let's try and keep the other one out. Come on, you stay out.
His partner, David Thornton, is advertising manager for a gay newspaper.
Okay, go on, eat it up. It's good for you.
As Harry Cohen waited for the results of his tests, the couple discussed how they'd coped with the sudden discovery that an unknown third party might have infected Harry.
Working as I do with other gay people was very, very fortunate for me. And I actually went through and talked to the people I work with, had a cup of coffee, said, I've had this real shock. And people were very, very good at springing in and saying, right, don't worry, it doesn't actually mean anything. It means just what it says, that there has been a contact. There is no automatic assumption of death and disease.
We knew, therefore, there was an emotional crisis which would be short-lived. We would get through it, and then we would get down to an easy, pragmatic, matter-of-fact way of dealing with it.
You've been together for, what, 15 years?
More or less.
It must have put a tremendous strain on the relationship.
No, it didn't in the least. If anything, the sheer fact that the relationship had lasted so long has been founded on trust, understanding, and always talking things through. That David was well aware of what could happen. We were both flawed that it was coming through to me first, but it was, this has happened, it's our problem, how are we going to deal with it? You know, so we went out to dinner, we got drunk, we laughed about it, we cried about it, and then we sort of came back down to matter of fact, day-to-day level. We know what it is, what it's about. I don't know who the man is who claims to have put me at risk. And I'm surprised to find that apparently myself and another person I know who was contacted by the same one were the only ones to send that man back a message of support saying, don't feel guilty for feeling that you've put me at risk. You're the one who's actually got it. I wish the hell there was something I could do for you. And we've got to remember those people are being ostracized, they're suffering, and they're not getting the backup that they need. I don't want to know who the man is, but I think about him a lot, and I just hope that he's going to be okay. And one thing that he must not have, and anybody who fears that they might have done it, they must not add to their own worries and fears any burden of guilt.
The unknown man who named Harry Cohen as a partner is a patient at St Mary's, Paddington. The health advisor here, with the difficult and sensitive task of contacting those at risk, like Harry, is Alana Macrina. Her job also involves counselling those who've been told that they've got AIDS for certain.
They're shattered. And all the problems, denial of any fatal illness, people denied, it's not happening to me, it happens to Joe Blogg down the road, not me. You know, you've made a mistake, go and check your results. 1 week spent and the mistake is not made. They say, what do I do now? Do I come into hospital? No, because you're healthy. Well, do I die? I mean, do I go home and should I phone my employer and say, that's me finished? And our aim is to keep them leading the life they want to lead and to work and to keep their life as normal as possible, because they can lead normal lives where they are not a danger to the general public. If they were, we wouldn't let them out of the hospital.
AIDS patients may spend most of their time out of hospital, but are always vulnerable to infections that will need urgent hospital treatment and often prove fatal. This week there are 4 AIDS patients being treated at St Mary's, in separate rooms here in the isolation ward. Staff visiting them wear disposable gloves and aprons. It's an expensive disease to treat, and the number of AIDS patients is rising very fast.
We have 118 cases at the present time. By the end of this year, we will certainly have something of the order of 400. That is a 400 total since the epidemic was observed in this country, so there's an additional 300 patients.
And a year after that?
Well, it gets hard to extrapolate, because I don't think we should assume that this disease will continue to expand in exactly the same way. But if we use the American model, then we're certainly going to be talking about a total of, say, 1,200 patients or more by the end of '86.
At St Mary's, it's estimated that each AIDS patient costs £20,000 to treat. So, with 300 new patients expected this year, the cost will be £6 million. When screening and counselling of those at risk is added in, the estimated cost of AIDS nationally will be £16 million. What about next year? What about the year after that?
Well, I think it's clearly going to be difficult to make firm projections until we see the way in which the epidemic goes in this country. But the fact is that if we're talking about even an 8-month doubling time over the next year or two, one is going to be talking about substantial figures, perhaps 40 million in '86.
The research side of the AIDS work at St Mary's is carried on at the Jefferis Research Wing. This is financed not by the NHS, but by different foundations and individual donations. This laboratory alone urgently needs a £20,000 refit for AIDS research. As for the AIDS patients whose blood cells are being isolated here, they're treated by the health service. And doctors say that more money is needed for this too.
Frankly, we're pretty stretched. I think it's hard for people to realise the impact that a relatively small number of patients can have on staff, but this is a disease unlike any other. It has elements from many others, perhaps. And certainly I've seen among my nursing staff and my medical colleagues who work with me on these patients enormous strains. But frankly, in terms of the coping aspect of the health service, we have to have some new solutions and not the sort of stock answer that this is going to have to be coped with within existing resources.
Well, every new emergence of a disease, if he's right about his estimates of where we're going to get to, does give rise to new pressures on the health service. That's what we give them more money for. We're talking about a £17 billion service that is getting £700 million more next year alone. So what we give that money to the health service for is for them to develop the service in response to people's needs. And with the comparatively small number of sufferers we have at the moment, I don't think there's any evidence the financial strain is causing difficulty.
If they say their strain is absolutely enormous and they can't go on for more than a few months.
Well, they would, wouldn't they? I mean, I do have people in the health service losing no opportunity to telling me they'd like more money for their unit.
Are you saying then that no extra cash at all is going to be provided because of AIDS?
I say there's an awful lot of cash going to the service already, and the reason we provide...
That's not the question, Minister, with respect.
Well, we don't actually, when I give out £700 million, I don't say so much for hearts, so much for livers, so much for kidneys, so much for AIDS. We give £700 million to the health service, and we say this is to enable you to deal with the new pressures on the service.
Although there have been warnings about AIDS for 3 years now, only in recent months have donors been given leaflets asking homosexuals and other high-risk groups not to give blood that might be contaminated. AIDS is transmitted either through sexual contact in semen or through infected blood. So one group at risk are those who receive contaminated blood in transfusions. There's no risk in giving blood. Tests for infected blood are not yet reliable and might not be available for up to a year. Even when they are available, there could be a problem.
If the test is only available in the blood transfusion service, the people in high-risk groups will come to donate a pint and have a test done for free.
So you're frightened of being swamped by possible AIDS patients who are coming here to get the test to see if they've got it or not, rather than giving blood and just using that as the excuse?
I'm very, very frightened of that possibility, not of AIDS patients, but of AIDS carriers.
So would you stop screening then, if you are the only place doing the screening and this was happening?
I would resist it very, very firmly.
AIDS has brought another potentially deadly problem to the transfusion services. This donor is not giving blood, but plasma. His blood is taken out, the plasma extracted, and the red cells are then returned to him. He's performing a vital service, and he's at no risk. The plasma is used to make a substance called factor VIII to treat haemophiliacs who lack a clotting agent in their blood. Britain is still not self-sufficient in factor VIII, despite assurances from successive governments, so we've been importing it from America. A large batch from America was contaminated with HTLV3, and this was passed on to up to 2,000 British haemophiliacs. It means that haemophilia labs like this one in Hampstead suddenly find themselves handling infected blood, and that maybe 20 British haemophiliacs can now expect to develop AIDS.
Our patients have come to live with that kind of uncertainty. This just adds a new facet. We haven't had anyone crack up. Our patients are remarkably stoical in the face of their condition. And with counselling and advice, we believe we can face this together.
Now, all this wouldn't have happened at all, presumably, if we'd been self-sufficient in factor VIII in the first place.
That is true. It's a tragedy that we are now hastily closing the stable door some 10 years after or probably 4 years after the horse has bolted.
New production methods ensure that all factor VIII will soon be safe, and rather late in the day, we're now rushing to become self-sufficient in it. This plant at Elstree is being hurriedly completed at a cost of at least £35 million. Even so, it will be useless unless the British public donates enough plasma.
We will need to treble our plasma production, and that is really will need a great deal of effort from the transfusion service.
So if we don't treble our plasma production, building Elstree is in some ways a waste of time.
Yeah, Elstree needs the raw material. Elstree needs plasma. Without plasma, there will be no factor VIII for the haemophiliacs. There will be no plasma for the burns.
How can you possibly get 3 times more plasma than you are at the moment? Isn't that going to be an
money.
enormous task?
Yes, it will be an enormous task. We will need money because we will need space, we need machinery, we need donors, we need recruitment campaigns, and all that testing, all that means money.
I certainly agree there needs to be an effort to get more plasma. It's the biggest problem we're going to face. We've got Elstree on stream. But at the moment we've put about £30 million into the development at Elstree. We've put more funds into the blood transfusion service. And when people lobby for more, I hear what they say, but I first of all have to make sure they're making the best use of all the money we're putting in.
Everyone wants more money to combat AIDS, and that includes the homosexual community. Monday night is gay night at the Hippodrome in London's West End. Next Monday there's to be a special AIDS benefit, the night of 1,000 frocks, to raise money for a trust named after Britain's first AIDS victim, Terence Higgins. The trust hope to raise about £4,000 from the event, towards the £100,000 they now need each year to run just one AIDS advice centre and helpline. Over the past year, they've dealt with 2,000 calls at their little office off the Gray's Inn Road.
Good afternoon, the Terence Higgins Trust.
Terence Higgins died 3 years ago. Since then, the Trust say, their warnings about AIDS spreading to Britain have been ignored by the government.
Well, they have been slow to respond, very slow. I'm convinced that certainly because it's a disease which is sexually spread and sexually spread mainly among homosexuals at the moment, that there has been a complete lack of concern. And I feel that it's only when the disease was shown to be spreading outside of that particular risk group, either through blood or through blood products especially, or now it's been shown to be that it can be heterosexually spread, that people are waking up to the problem and are saying, we must do something. But we've been seeing the disease for the last 2 to 3 years, and not enough was done.
The gay community do feel a little persecuted at times, and I understand that, but the reality is that this particular disease is the most researched communicable disease in the world, I would have thought. The terrible problem is we don't at the moment have any effective treatment or cure for it, which is why so much effort's going into developing treatment, cure, vaccine, be what it may. And until we break through in that way, there are going to be difficulties, but it's not prejudice against the gay community.
The Trust also complain of the way the media have handled the AIDS problem. They say the headlines have been sensationalist, ill-informed, and liable to increase fear and prejudice against homosexuals. The effect of the press coverage on AIDS patients themselves has been disturbing.
Any work we do is destroyed by the newspapers, and yes, we'd like to say don't buy any newspapers. You know,
is that bad?
Yeah, I mean, our advice is don't read them. Please don't read them, because we read them and think, oh my God, you know, you read them. How on earth they must feel that, you know. Although we hear how they feel and they talk to us about it, to be inside that person's head. I mean, it's cruel. It is so cruel.
This week, a journalist who shares those feelings went to St Mary's to learn the results of his test. Harry Cohen was to find out whether he was at risk, whether there were HTLV3 antibodies in his blood.
I understand. Well, how are you?
I'm feeling quite well, mildly so considering the winter.
Good. We've had some results back since we last saw you. We've looked at you in 2 ways, immunologically, to see how well the immune system is working. And we've also looked at your blood to see whether you've been exposed to the AIDS virus. And the answer to the latter is that you haven't, which means that you don't have any detectable antibody against the virus in your blood. So from that point of view, you're at no immediate risk. We hope, and hope by the end of the year, that we may be able to test for the virus itself, which is clearly the most important point, to be able to assure you that you are truly negative and uninfected. But negative tests are a little more difficult to interpret, because if you don't have antibody, it's either because you've never been exposed, in other words, you've never been infected, or it's because you're in this rather difficult period, which we call a window period, between infection and development of antibody in the blood. And for this reason, a single one-off, a negative test, is probably not enough for someone in your position.
So Harry Cohen still didn't know if he was completely in the clear. His immediate concern, though, was for the unknown patient who'd named him.
There's one thing actually I want to ask you. The man who gave my name as a contact, the last time we spoke, you told me that he was very ill. Are you in a position to let me know how he is now?
I'm told he's still alive, but still ill.
Well, would you repeat the message?
Yes, I shall.
Good. Good luck, no hard feelings.
I understand, I've had already told him that.
And if there is any kind of support that we or anybody else can give, please let us know, through you or through the health worker.
Meanwhile, the search for a cure goes on, until one is found the number of victims will continue to rise, and rapidly. AIDS is something we'll have to cope with without hysteria.
It's a nasty, lousy bug that has come along. That's all it is. And some of us are going to have to learn to live with it, and everybody else should too.
And we're sorry about some rather variable sound quality towards the end of that absorbing report by Rob.